assessment of thorax and lung. So, hello sir, for verification purposes, may I know your name, age, and birthday?
I am Christian Kaini Bayan. I am 18 years old. Born in June 16, 2000.
Okay sir, what do you want me to call you?
You can call me Kaini.
Thank you sir. Before I assess your lungs and thorax, I will perform hand hygiene and wear a glove to prevent the spreading of microorganisms. So, the lungs and thorax assessment is important to check your oxygenation status and know if you have abnormalities in breathing. So sir, I want you to stay calm and kindly follow my instruction. Okay sir? So let's proceed to the lungs and thorax assessment. So first, position the patient in a sitting position or a stand position and make sure that you provide a patient privacy. So sir, I want you to place your hand to the side where I am observing your skin and anterior structure. So inhale, exhale. So there is no lesion and his anterior structure is normal and symmetrical to each other. So next is observe the client's posture, position, and his ability to support weight while breathing. So sir, inhale, exhale. Sir, you have a good posture, so you have no scoliosis, and you can normally support weight while breathing. So sir, I will now check the movement of the accessory muscles as you breathe. So, inhale, exhale. So the accessory muscles that you use is sternocleidomastoid muscle. So the next that I will do to the patient is the posterior. So first, I will observe the skin of the patient and posterior structures while the back is exposed. So inhale, exhale, inhale, exhale. So there is no signs of abnormalities and there is no lesions. So the next I will do is palpate the spinous process. So they are evenly spaced and not tendered. So next is assess the respiratory expansion. So I will place my hand on the posterior chest wall with my thumbs at the level of T10 and observe the movement of the thumb as the client takes a deep breath. So sir, inhale, exhale, inhale, exhale. So as I observe, the movement of my thumb are equally apart and shows normal. So next is I will palpate the fremitus by placing the ulnar aspect of my hands to each area to assess corresponding symmetry and vibration. So sir, can you please say 99 while I'm moving my hands to the area? Okay.
99, 99, 99, 99, 99, 99.
His fremitus is normal because it is unequal and moderate while saying the 99. So it doesn't decrease or increase that is signs of any abnormalities. Next is percuss the posterior lungs and thorax, starting from the apices of the scapula and across the top of the shoulder through the intercostal spaces, across and down to the bases of the lungs, comparing both sides. It produces resonance percussion, which is normal. It does not produce dullness, hyperresonance that can be a sign of pneumonia, and emphysema. So the next is I auscultate the posterior thorax as the patient slowly and deeply breathes in through the mouth. Okay. Exhale. So the breathing of the patient is normal and there is no signs of abnormalities. So let's proceed to the anterior thorax and lungs. So first, assess the anterior thorax. I will begin with the bones and muscles for retractions and accessory muscle used when breathing normally. So, okay. So the client is in a sitting position and I observe that there is no lesions and there is no signs of diseases. So next is I will palpate the anterior thorax for lumps and tenderness using my finger palms. Okay. There is no signs of abnormalities and the lungs of the patient is normal. So next is I will assess the respiratory expansion. So I will place my hands on the anterior chest wall with my thumbs pointing towards the xiphoid process and I will observe the movement of my thumb as the client takes a deep breath. Inhale. Exhale. Inhale. So as I observe, the movement of my thumb are equally apart and shows normal. So next is I will percuss the anterior thorax starting from the above of the clavicle down the chest wall from side to side. So there are all normal and no signs of alteration. So next is I will auscultate the patient for the apical pose for 1 full minute while the client is in a supine position. The apical pulse of the patient is 71 beats per minute. The next that I will do is I auscultate the aortic, tricuspid, and mitral for heart sounds. All the heartbeats that I heard seems normal. So the last that I will do is I auscultate the anterior chest with the diaphragm of the stethoscope. So there is no signs of abnormalities in the anterior chest of my patient. So this is the demonstration of lungs and thorax assessment. That's all. Thank you.